77-year-old man with type 2 diabetes is admitted to hospital because of chest pain and dyspnea. Serum troponin level are elevated. ECG shows ST segment depression in lateral leads. Percutaneous coronary angiography is performed. Occlusion of the still left anterior descending coronary artery is identified. Pharmacotherapy with eptifibatide is initiated. Eptifibatide is initiated. A drug-eluting stent is placed in left anterior descending coronary artery. Mechanism of eptifibatide acts is similar to which of the underlying pathology in this condition? Remember, they're asking, we have to remember the mechanism of action of eptifibatide. Well, you can do via elimination method, which is very common. So the answer here is E. It's a Glanzmann thrombosthenia. Glanzmann thrombosthenia is the answer. You should not have changed it. Bhakti. Okay, let's go through other options. Von Willebrand disease. So the patient here have decrease in von Willebrand factors. Vitamin K deficiency is seen as warfarin. Protein C deficiency is seen as hypercoagulable state. While TTP, it's a patient is having ADAMTS13 mutation. Okay, eptifibatide as a mechanism of action by blocking. You can see in this image. Wait, I'll pull up the image. Here you can see they have GP2B3 receptor antagonist. One of them is eptifibatide. This blocks the GP2B3A. Remember, there is adhesion, secretion, and aggregation. So Glanzmann thrombosthenia blocks the aggregation pathway, and it's most commonly done via platelet 2B3A and fibrin. Okay, you can see here. This image clearly says where there is deficiency of GP2A 3B complex causes Glanzmann thrombosthenia, where they have GP1B causes Bernard-Soulier syndrome, and when there is von Willebrand factor deficiency, it causes von Willebrand. So Glanzmann thrombosthenia, it is autosomal recessive defect in aggregation of this platelets. It has decreased GP2B and 3A, causes decreased platelet to platelet aggregation, remember, and blood smear shows no platelet clumping.
Thanks for watching. Please give a thumbs up and subscribe for more.